This week, we highlight another life well lived. Many of the doctors and nurses working long shifts right now inside the country's busiest emergency rooms and intensive care units assume at some point they will contract coronavirus themselves. Thousands of them have already. This week, America lost its first ER doctor to the virus. Dr. Frank Gabrin was an emergency room physician at East Orange General Hospital in New Jersey, the state with the second most cases in the country. He spent the last several weeks treating patients with coronavirus. Last week, Dr. Gabrin began to feel chest pain, and even without a test, he immediately recognized the symptoms he'd seen in those patients. A two-time cancer survivor, he stayed home to recover so he could get back to the hospital and into the fight. On Tuesday morning, though, Dr. Gabrin had difficulty breathing. His husband, Arnold, called 911, but Frank died before help could arrive. Arnold said later, "He died in my hands." Frank Gabrin was born and raised in rural southwestern Pennsylvania. As a young boy, he would apply bandages to neighborhood pets. His mother knew he would be a doctor. Frank couldn't afford medical school at first, so he joined the U.S. Navy Medical Corps, where he served for 4 years before getting his training in emergency medicine. During the 90s, Dr. Gabrin worked as a Metaflight physician in Cleveland and volunteered in the Cleveland Free Clinic's HIV/AIDS program. In 2013, he wrote a book to help other healthcare professionals manage the stress and anxiety of working in the ER. He was offering that critical guidance right until he left the hospital last week. Dr. Frank Gabrin, a heroic physician who gave his life to the fight against coronavirus, died at home on Tuesday. He was 60 years old.